Hello, good afternoon, everyone. This is such a long and interesting day, and I request your patience and attention for a few minutes. So, the title of our research paper is A Modern Tech-Driven Approach to Prognosis Powered by Real-Time Healthcare Record Updates from the Patients. The paper is basically about some required improvements in the old system and some modern tech-driven solutions that might solve the critical issues faced during the emergency situations. Starting with the abstract of the paper, the medical records in the current healthcare system consist of self-reported patient information along with the doctor's notes on diagnosis and treatments. The importance of the medical records, there's so much more to it. Up-to-date medical records typically contain self-reported details such as contact, demographic information, lifestyle habits, medical history, vaccination information, and past test results. The primary reason why up-to-date healthcare medical reports are super essentials is that they can save lives during emergencies. In this study, we aim to present a system that helps doctors get the necessary information of the patient beforehand. So in case of emergency, based on this data, the doctors can decide and start preparing the pieces of equipments and medicines before it's too late. So moving towards the introduction section of the paper, I would like to explain to you the main objectives of the paper. The main objective is to develop a system that holistically gathers the medical history of a patient before any medical assistance is sought. When critical patients arrive, a lot of time is wasted on reporting patients' illness and medical history. Therefore, patient monitor is an efficient system used to carry out quick 30 seconds diagnosis using heartbeat, temperature sensors to record vital parameters required to start any treatment by the doctors and remotely transmit these parameters over the wireless mediums to the hospital even before the ambulance is deployed. So DELAS 18820 is used to measure the body temperature level of the patient. The heart rate sensor will measure the heartbeat of the patient, and the ECG measures the electrocardiogram of the patient as well. So the whole system is working on the base of cloud system. Now let us explore the literature review of this paper as well. There are 4 categories of healthcare system, that is C health, E health, M health, and S health. The C health is the machine where the machine equipments are used, the authentic way of the medical report testing. E health is electronic healthcare checkup that the data is stored on the system. M health is a mobile health type, that just alerts the patient and not the doctor. Then the patient is supposed to visit the doctor and alert them about the situation. And S health is the smart health option where the doctor gets alerted directly and they know that the patient can be in the emergency situation and can start working on it as soon as possible. So problem identification. So when critical patients arrive, a lot of time is wasted on reporting patients' illness and medical history. So why is this whole thing required? After reaching to the hospital, the patient must go through the long procedure of medical tests and reports that takes minimum an hour or 2, which leads to a negative impact on patient's health. Sometimes, due to the emergency cases, the doctors may not be available to diagnose the patient as well. So this is really dangerous for any kind of patients. So the main objective behind this whole project is to develop a system that, as I said earlier, that holistically gathers the medical history of the patient before any medical assistance is sought. In addition to that, the system should gauge the heart rate, ECG, body temperature of the patient that is destined to be sent to the doctor. Armed with the medical history and the current measurement of the patient's physiological conditions, the doctor can observe the current situation of the patient prior to them actually reaching to the hospital. Okay, so there goes the methodology of this whole project. Okay, so the whole methodology of this system is explained in the methodology section. The sensors measure the health parameters of the patient. They are assembled together in a single system with the Arduino and the Raspberry Pi. The Raspberry Pi sends the whole data to the cloud server, and that is uploaded to the Android application and the website. Then goes the experimental setup and design procedures that we have tested on the real life patients. As mentioned, is following the table of the experiment conducted for the research work. The data privacy issues, we are attaching the dummy data of the patient's name. This is the design of the whole application, and the results and discussions are 97% accurate. We have measured these whole readings in medical equipments, as long as with the sensors that we have developed. So jumping on to the conclusion, this paper addressed the current demands and necessity of providing a contactless health-based sensor technology that gives early warning to the doctors about the medical emergency detected through the cloud-based health monitoring system. The sensors integrated with the Arduino Uno measure body's vital parameters of the patient and send those to hospital tasks in case of emergencies. Using an Android application, we are displaying the parameters in graphical representation and sending the result to the cloud. So this was the whole project that we have developed. These are the references that we have taken reference from for developing this project and idea. So any questions? Thank you all for paying attention towards this attempt of my first research paper presentation. Thank you so much.